The governor sounding the alarm, saying while the state is making progress in the fight against the coronavirus, things will get worse before they get better. That has the governor pushing for an extension of the state of emergency here in Michigan, and we do want to hear from you. Should state lawmakers grant the governor's request to extend that declaration of emergency? Yes or no? 7 Action News reporter Ross Jones live with more on what Governor Whitmer had to say today. Ross?
Brian, good afternoon. The number of positive cases and deaths here in Michigan, and especially in Detroit, continues to steadily rise. But Governor Whitmer said today that if you know the right places to look, you can see signs of progress.
This isn't just Michigan's fight. To get through this, we have to be united as a country against this virus.
With Michigan now the third hardest hit state by the COVID-19 outbreak, Governor Whitmer said today there are small signs for hope.
Several hospitals are reporting that discharges of patients are picking up. It does not mean the number is going down, but it does mean that we're slowing the rate of increase.
And to keep that progress going, the governor said she is likely to extend the state's stay-at-home order, which went into effect 2 weeks ago. Whitmer also reported an increase in state testing. Less than 2 weeks ago, Michigan had conducted only 9,000 tests for COVID-19. But as of Friday, that number grew to more than 40,000. And by the end of the week, the state expects to begin treating patients downtown at the TCF Center, a field hospital that could treat up to 1,000 people. But the state's chief medical officer said more doctors and nurses are still sorely needed.
We still need medical volunteers. There's no question about that for the TCF Center and other centers that we will need to stand up.
And then there's the question of when our region and state will see the apex of coronavirus cases.
All of those counties, Wayne and Oakland, they're all on the upside of their curve.
On Saturday, the White House said Detroit, along with New York and New Orleans, could see its peak this week.
In those three hotspots, all of them hitting together in the next 6 to 7 days.
But the governor said the state's modeling from the University of Michigan says otherwise, estimating it'll be several more weeks before cases here begin to fall.
We anticipate that the peak is end of April, beginning of May at this juncture.
The governor's office said today that just under 3,800 patients are hospitalized across the state of Michigan, 89% of those patients here in Southeast Michigan. We're in Detroit tonight. I'm Ross Jones, 7 Action News.
Ross, thank you.